Hello, my name is Amanda Roberts and I'd like to share with you how we're using comics to ignite patient activism within the PATCHATT initiative. So, within this presentation, I'd like to begin by introducing the PATCHATT initiative. I'd then like to explore how individuals with a life-limiting illness can develop as health activists, and then to explore the use of comics as catalysts for this activism. I'd like to begin by telling you a bit about the origins of the Patients Changing Things Together, or PATCHATT initiative. So PATCHATT arose out of a response to the COVID pandemic. Our local hospice was unable to continue to provide day therapy support for patients with a life-limiting illness. To fill the gap until normal services could resume, I introduced an arts-based online support group. There were some really interesting conversations within this group which revealed the way in which serious illness can severely diminish a person's positive sense of self and their belief in their ability to act to change anything. We realised that people needed not only a normal support group where they could share experiences, but a support group with a difference, where they could help one another to make a difference to things which mattered to them. We therefore formed a working group of patients, carers, clinicians, researchers, academics and volunteers who together developed the PATCHATT initiative. PATCHATT is an online, facilitated peer support initiative for adults with a life-limiting illness. The aim of the PATCHATT initiative is to support those adults to make a difference to something which matters to them. We meet for 1 hour per week for 6 weeks. Participants share a small, doable change they wish to make in their lives and are supported to plan and carry out actions needed to bring this about. They're also supported to set up their own peer networks, if they wish to, at the end of our 6 weeks together. Adults with a life-limiting illness often have clear insights into ways to improve both their own quality of life and wider health service effectiveness. However, general nervousness about such patients' complex health issues often disbars them from project leadership roles. A shifting health context provides new opportunities, however, through the new public health movement's shift towards participative, community approaches to supporting the sick. Research such as South et al.'s report for Public Health England and O'Mara Eves et al.'s systematic review both cite persuasive evidence that enhancing individual voice and control can have a positive effect at both individual and system levels. Within the broad community empowerment field, exploring social movements in health is particularly helpful in illuminating patients' leadership potential. Social movements in health draw on community or people power to promote or resist changes to healthcare provision through innovative approaches to care and policymaking. This approach is increasingly supported by public policy. NHS England's 2014 5-year forward view, for example, specifies an ambition to build a social movement which shifts power to patients and citizens to improve health, well-being, community strength and NHS capacity. The term social movement implies large-scale activity over time. However, the term health activism, denoting action taken within social movements, can be applied to the single actions of individuals. Definitions of health activism differ. However, its underlying principle of purposeful, morally driven action to bring about impactful change across the healthcare ecosystem is generally accepted. Exploring health activism sets up the broad areas of change which might be led by adults with a life-limiting illness. However, the processes individuals might use to bring about such change are less transparent, as is how they might develop as change agents. Bronfenbrenner's 1994 work on ecological models of human development is helpful here. Bronfenbrenner proposes that human development relies on repeated interactions, termed proximal processes, between people and their environment, termed an ecosystem. His work suggests two areas of development are needed to support palliative care patient activism. The first is the development of individuals as leaders of change. The second is the development of processes which these individuals can use to influence dominant systems, beliefs and values within healthcare systems. To start with the development of patients as leaders, Bronfenbrenner proposes that successful change relies on a careful consideration of the elements in the ecosystem in which development is sought. For palliative care patients, the ecosystem might be understood as comprised of the microsystem, the individual and their home environment, the mesosystem, the individual and the organisations which support them, such as hospices, the exosystem, the wider healthcare services of which the individual may or may not be a part, and the macrosystem, the dominant pattern of societal beliefs and norms. The development of patients into health activists who can influence across these systems may seem unlikely. However, patient and public involvement in user-led research has long paved the way for such activism. For example, user-led research's principles of inclusivity, reciprocity, and power sharing accord with health activism's emancipatory aims. Equally, recent critiques of activism emphasise the need to acknowledge the importance of small-scale change, rather than reserving success for system-level change. We therefore encourage PATCHATT participants' engagement with the intimate activism of trying to change things at family or micro level, as well as their attempts at influencing wider accepted norms and discourse around dying and death. The coping strategies evidenced by many with a life-limiting illness show that individuals have the bravery, tenacity and hope needed to bring about change. The nature of the proximal processes which support them in developing as change agents are less well understood, however. I'm therefore going to share with you how comics are used to fulfil this role in the PATCHATT initiative. Comics have long been used in the field of health to share patient experience, support patient decision-making, and deepen patient and healthcare professional education and understanding. They also act as catalysts for the development of patient selfhood and dignity. This ability to catalyse change positions comics as powerful potential activist tools, promoting social transformation through their capacity to inform and persuade. The production of grassroots comics has much to teach us about how to support palliative care patients as health activists. Coming out of Pakalin and Sharma's work in India, individuals create grassroots comics to express their views, beliefs and feelings about issues which are important to them. Completed comics are photocopied and pasted up locally, giving everyone who can access a paper and pencil the opportunity to influence change. Although they usually relate to the activities of a group, grassroots comics also have the potential to illuminate individuals' experience of illness and to support their plans for change. Within PATCHATT, we use what we term catalyst comics to fulfil this storytelling and activating role. Following Bronfenbrenner, we use the reading of catalyst comics produced by group facilitators as a proximal process to provide a call to action for participants in developing their change agency. PATCHATT comics tell the story of how 3 adults with life-limiting illness, Bob, Nita and Sylvie, develop as such change makers. I'm going to share Nita's comic with you to illustrate how such comics might catalyse change. Nita's comic is in 3 parts and is shared with group participants across 3 PATCHATT sessions. In part 1, Nita shares her story, the problem she's currently facing which she wishes to take action to overcome. Humans have long told stories to help us understand the nature of the world and how we fit with it. This storytelling function becomes particularly important when we become ill. It allows us to surface our values and share our experience in order to make sense of it. Nita's story focuses on the difficulties and frustrations she experiences through having to repeat basic information about her illness to a plethora of healthcare providers. Nita is presented as lacking any agency within the healthcare system, with the 4 panels illustrating in both words and images the physical and psychological impact of her problem. However, Nita does not seem to want to criticise the healthcare system, but is focused instead on searching for a solution. The comic format of Nita's story allows PATCHATT participants easy access to her experience and allows them to relate it to their own. The combination of pictures and text supports this sense of association with a recognisable issue. In sharing her issue, Nita capitalises on humans' need for affinity and group membership. Telling her unique story is the first step both in securing support to solve her problem and in engendering feelings of mutuality within the PATCHATT group. The group's ability to recognise and empathise with Nita is fundamental in her developing an activist approach to change. In part 2, Nita draws more overtly on the experience of her fellow PATCHATT group members to develop a plan of action to address her problem. The 4 panels in Nita's plan illuminate how she is able to move forward after telling her story and begin to imagine a new way forward. The panels clearly illustrate the reciprocity at the centre of storytelling. Her fellow participants offer encouragement and practical suggestions to support her decision-making process, a real strength of the comic form. Nita responds positively in the 3rd panel, adopting the listening and responding roles implicit in storytelling and encouraging group members to continue to engage with her problem. Nita has drawn attention to an issue which makes her life more difficult. This might be deemed an example of health advocacy. However, with the help of her fellow group members, she begins to formulate a way forward. Such plans move Nita beyond advocacy and towards becoming a health activist. She is planning to take action herself to bring about change. Nita's problem and her fellow group members' proposed solutions could also be seen as a counter-story, challenging normative thinking and practices. This counter-story persuades Nita, within the panels, of her latent change leadership potential. It also persuades the reader outside of the panels of their own capacity to make a difference. So group members' joint efforts to bring about change may result in a collective activist identity which can be used to ignite the agency of other group members. Activism becomes self-perpetuating, challenging its association with conflict and highlighting how shared endeavour enables mutually rewarding transformation. The impact of being active agents of change can be seen in group members' positive expressions and body language in panels 2 and 4. In part 3 of Nita's comic, we see the positive influence Nita's activism has had on her state of mind, illustrated in both her words and her changing visual demeanour across the 3 parts of her comic. Her reference in the second panel of this final comic to being treated more like an individual now is particularly important. Nita appears to have recognised that taking constructive action allows her to develop some agency in her encounters with healthcare professionals, and also develop her sense of individuality and positive identity. Nita also has the potential to make positive changes at system level. She works within the system rather than outside of it, using her experiential knowledge to effect reform. Although she's not directly influenced system-level processes, her "This is my story" sheet may well be circulated by her healthcare professionals and developed further. In offering solutions to a common healthcare problem, Nita and her PATCHATT friends have attempted to democratise knowledge production and dissemination for both their own and system gain. Drawing on a health activism approach, Nita has taken decisive action to make the change she wishes to see. However, not all change happens this way. Yalom's concept of rippling suggests that without knowing it, we are creating concentric circles of influence. Things we do enrich others, and they pass this enrichment on. Nita's comment in the third panel that this is a step in the right direction acknowledges that we can't know the full extent of our actions' impact. In a study of attention deficit disorder, Radisks and Sir propose that a phenomenon diagnosed as a problem can be reimagined as a spur for critical reflection on the system in which the problem occurs. This argument resonates with our thinking within PATCHATT. Here, we seek to challenge dominant health system and societal discourse around the ability of patients with a life-limiting illness to lead change. Through the presentation of simple, relatable stories, comics stimulate adults with a life-limiting illness to challenge the inequalities between system and individual, in order to make a difference to something which matters to them. It is this moral purpose which comics ignite, supporting people to resist negative understandings of terminal illness and assert themselves as active, positive agents of change.